Welcome to the live stream here, November 13th, 2022. This is going to be a Q&A session. So if you have questions, maybe it's about intermittent fasting or about metabolic health, nutrition, general health, go ahead and ask away. And let's see, we already have some people. Hello, Tony Booker, Sandy G. Good evening, good morning, wherever you are. From Rockford, Illinois, Central Time. Where are you all from? Tell me in the comments here where you are in this world. Hello from London, New York, Dallas, Texas, Jacksonville, Venice, Arizona, America, Colorado, UK, Greece, Canada, San Diego, beautiful San Diego, Rosemary, Casper, Wyoming, Milwaukee. Oh, I love it. All over the globe. Israel, Boston, go Pats, Maryland. This is fantastic. Welcome, everyone. So glad to have all of you here. And I'm excited. This is my first live stream in probably almost 2 years. So welcome to the live stream. And I plan on doing this once a week. And I'm going to have most likely guests in the medical field. So this is going to be a fun experience. How can we fix broken medical system in the United States? I'm not going to be able to answer that one in this video. Sorry. And can you all see me okay? Someone said a black screen, but my monitor shows that I'm okay. Can you tell how to avoid headaches and lightheadedness with intermittent fasting? Yeah, it's a good question. So lots of times when you're intermittent fasting, what ends up happening is if you're doing it for too long, your glycogen stores can become depleted and you start burning ketones for fuel. And in that case, if that's a prolonged state, then you can get lightheaded and dizzy, especially if you're working out. And that's a debate in itself. Should you be working out in a fasted state? Now, there's some evidence that says that workouts are actually better in a fasted state, but I think it really depends on the individual. For example, there's been 2 times where I was working out in a fasted state, and about a half hour into my workout, on both times, I started getting lightheaded, and I was like, "This isn't good." So I need to get some nutrition in me, especially some carbs. And then actually, I felt the lightheadedness went away once I did that. So if you're feeling lightheaded or dizzy from intermittent fasting, definitely stop what you're doing, get some carbs in you, and it'll get better. And you probably are just doing too much intermittent fasting for too long of a time, or maybe you jumped into it too quickly, or you went from one extreme to another too quickly. So if that's the case, you can gradually go longer and longer with your fasting. So for example, you can start out doing, if you're doing time restricted eating, you can start out doing a 12-hour fasting, and then maybe once a week you can prolong that by an hour. So maybe the next week would be 13 hours, and then following 14, and so on. So okay. All right. Sally MJ, 67 with high blood pressure. How do I lower it without meds? I don't take any meds. Physically healthy other than 152 systolic blood pressure. Well, most blood pressure is actually dependent on insulin resistance when it's high. So partly is salt, but usually when the kidneys are functioning fine, assuming you're having normal functioning kidneys, it's the insulin resistance that leads to the high blood pressure. And insulin resistance is really stemming from too much sugar, especially fructose. So if you're able to cut down that sugar, especially the added sugar, to less than 25 grams per day, and you do this consistently over time, I would expect that over the next few months, that blood pressure is going to come down on its own. But definitely you'd have to check in with your doctor and see what they have to say about that. And definitely, I mean, the most important thing is getting the sugar down. Also, exercise is going to help too. And sometimes stress and anxiety can be contributed to that as well. So, but in terms of like the biggest factor, it's definitely bringing down that amount of sugar that you're consuming. You've lost weight since 2020. Did you change your diet? Yeah, you know what? I did lose weight. Actually, it's pretty noticeable that my belt size, like my pants that I used to wear, they're all really big on me. Probably like shrunk 4 sizes, to be honest. What I did was, so during COVID, during 2020, I was definitely stressed out and I was working long hours. I wasn't exercising that much just because I spent all my time in the ICU treating COVID patients. And I would get, yeah, I do a lot of stress eating, and then the hospital food isn't good for you. It's all processed food, and what little is unprocessed, like salad and stuff, it just didn't taste that good. So um, I would just, eat for pleasure lots of times or stress eating, and so I was definitely like, gaining some pounds, and I wasn't exercising on top of that. And I lost my intermittent fasting um, steadiness because before the pandemic started, I started doing intermittent fasting and it was great. And then I lost it. So anyway, I started working out again for the past, ever since I got COVID at the end of May on a really consistent basis, about 6 times per week. I have been doing intermittent fasting, and the key is eating unprocessed food. So I've been doing all those things since for about almost 5 months now, and yeah, it's been noticeable. I definitely shrunk probably like 4 sizes. So yeah, I feel great. That's why you can't really go wrong with any of that stuff. Can you simplify intermittent fasting, please? Asked Dennis Morris. Sure. Basically, fasting is depleting your glycogen stores so that you switch the metabolic switch, going from burning glucose to burning ketones. And when you do that, you're allowing the AMP kinase enzyme in your cells to turn on. And when this turns on, it's actually stimulating your mitochondria to replenish themselves and to do the housekeeping of the cell. So that way, if you think about your cells, it's like if you have people at your party, and you're hosting a party, right? And people are coming over. Of course, you start out with your place nice and clean, and people are coming over, and then they're eating and stuff, and then they're throwing away their trash, and you got to clean up after the party, right? And so you don't want to clean up the next day. You want to clean up that same night. So sleep allows you to do that, but also intermittent fasting allows you to do that. So what it does is it's cleaning the whole house after the party, and then you're ready for the next day, as opposed to the next day starting with a messy house. So intermittent fasting allows your cells to replenish themselves and to start fresh and be metabolically healthy so that your mitochondria are functioning at the best. And the mitochondria is really the core of all of your cells and your energy in your life. So when your mitochondria are working at their best, you feel better, you have more energy, and it's just overall metabolically healthy. And that's going to help you to prevent all these chronic metabolic diseases. So even things like Alzheimer's, lots of types of cancer, fatty liver disease, high blood pressure, high cholesterol, all of these metabolic issues that lead to chronic diseases, the more that you can do to prevent that in the form of fasting and eating unprocessed food and exercise, that's going to be, the best thing for you. Let's see. ADHD with Ritalin eating plan ideas. It's interesting you mentioned ADHD because one of my friends, psychiatrist, Dr. Hisbi Ali, I plan on having him as a guest to do a live stream like this probably next week. And so ADHD is probably the first topic that we're going to tackle. So I'll save that question for that live stream. Any tips on fasting with low blood pressure? Everyone's different. Some people have a normal low baseline blood pressure. So these numbers that are say, okay, what's a typical, normal blood pressure? It's going to vary from person to person. The main thing you want to know is, with that low blood pressure, are you getting lightheaded or dizzy? And if that's the case, you should probably get that checked out. But lots of times, low blood pressure is, if it's going to be problematic, it's there's different medical conditions that could cause that, if you're not getting enough salt, for example, or some kind of like adrenal issue. But if you're if it's constantly an issue, you might just need more nutrition, but it's again, you should check that out with your doctor. Okay. Is it safe for a diabetic person to do fasting? That's an interesting question. So there's a lot of debate about that. First of all, there's type 1 diabetes and there's type 2 diabetes. The main concern, a lot of people with type 2 diabetes, they want to reverse it or at least improve it. So it comes down to, are they on medications? Are they on insulin? Are you on oral medications for the type 2 diabetes? Lots of these oral medications cause hypoglycemia, where your blood sugar is low, and that can lead to dangerous symptoms. But usually, intermittent fasting will not, by itself, will not cause hypoglycemia. You do have to be careful, and you should check with your doctor. If you are going to do it, you should start gradually, and also be working with your doctor to say, okay, we're going to start to taper these medications as long as you're doing okay and the blood sugar is still relatively well controlled. You're not having these lows where you're getting hypoglycemic. So um, it's something that is very much up for debate, because on one hand you want to improve the diabetes and reverse it, but you don't want to go the dangerous route and go too extreme. So I think the general recommendation would be to go slow and definitely work with your doctor, especially if you're on medications. Yeah, William Huang. So, in regards to intermittent fasting, how does one avoid the terrible headaches that come with it? That is a great question. This happened to me once, and then my dad started doing intermittent fasting, and he started getting headaches. So, I think that if you're having issues, the key is really to go slow. Maybe it's too much of an extreme when you're starting out. So again, starting out with 12 hours. And then the other aspect of it is, besides gradually going longer and longer, is try to eat foods that are going to keep you feeling fuller for longer. So for example, when you're eating unprocessed foods, things that have the carbohydrates with the fiber that break down slowly, are digested and absorbed much slower, those are going to hang around in your system. And also when you're cutting out the sugar, what happens when you eat sugar, especially if it's a simple sugar in the form of a candy or liquid or a donut or something, what ends up happening is you get this insulin spike, right? And then when you stop eating the sugar, the insulin comes down. But these cycles of up and down leads to all sorts of issues. So you want to avoid that. You want a very steady, increase and decrease like this, and that's going to help you to avoid symptoms. But the key is also to go gradually. So if you could do gradual, as well as eating healthy foods with the long acting carbs, with more of the amylose as opposed to amylopectin, and fiber in that as well. That's going to help to steady out all your hormones and not have all these wild swings. So that's most likely going to help you to get over that hump of that, initially those first 3 to 4 weeks of fasting. Also, yes, someone said drink water. That's a given. You should always drink plenty of water every single day, no matter what you're doing. Glad you mentioned your dad. Intermittent fasting for 70 plus who are active and generally healthy for the age. Yeah. And Roman, yeah. There's debate as to, if you're someone who's in your 80s or 90s and you're malnourished, then that person shouldn't do intermittent fasting, because you're concerned that they're not getting enough nutrients into the body and you're wasting your muscles away and so forth. So in that case, 70 plus who's otherwise healthy, yeah, absolutely. Fruits, yeah, fruits are good. So, study by eating fruits all day. So, fruits do contain sucrose, but they also have fiber in them to help to slow that digestion absorption. But the longer acting carbs, so amylose is a starch, and so when you're eating things like beans or wild rice, that's going to have not only fiber in it, but also the long acting starch, which is the amylose. Amylose is it's a single chain, so what ends up happening is it takes longer to break that down, because only two enzymes at a time can start breaking that molecule down. But the amylopectin is branched, and so when you have that branched starch molecule of amylopectin, multiple enzymes can work at it at once, so you end up breaking it down faster. So that's why when you go with whole intact grains that have the more of the amylose as opposed to amylopectin, pectin actually takes it longer to digest and absorb, which is a good thing. Also, those foods also have the fiber, which also means slower and longer absorption. Okay. Mike, can you answer my question? You advise somebody to avoid sugar for high blood pressure. What about reducing fatty food? Would you not want to reduce the saturated fats found in meat? So, saturated fats are very controversial. I did make a video that's dedicated towards that. Um, Not all saturated fats are bad. So, some are bad, some are fine. The key is the recommendation would be to keep them in moderation, whatever you're eating. Generally speaking, the ones that are better for you are found in dairy. The ones that are generally worse for you would be things in pork and beef. So, my general approach is it's okay once in a while to eat beef or even pork. The main thing is to go with the unprocessed stuff. So grass fed would be ideal. Same thing for dairy is you generally want grass fed. So I think it's better to just the general rule of thumb is keep things in moderation. Of course, coconuts have saturated fat too, and I'm a huge coconut fan. But those actually have the good types of saturated fat. So whatever it is, it's the key is moderation. But in terms of blood pressure, the main thing is absolutely the added sugar. That's what you want to make sure you're limiting to no more than 25 grams per day. Also, most people don't get enough fiber, and that also is a big contributor in terms of how that affects your sugar absorption. So most people, for example, get about 10 to 15 grams of fiber per day, and I'm talking about getting both soluble and insoluble fiber, especially the insoluble fiber because that's the one that's hard to come by. So if you can aim for 25 to 30 grams of fiber from whole food, like real food, that's the goal because that's going to get you both the soluble and the insoluble. Best meal to eat while doing one meal a day? I'd say, whatever you like that is whole food or real food. And it's going to keep you feeling full for a long time. So, for example, beans, big fan of chickpeas, lentils, vegetables with that. So, like broccoli or peas, whatever you like to do. And a lean meat. So, like a salmon or a chicken breast that's lean. That'd be a nice, wholesome meal that has pretty much all your groups in there. So, I've noticed you use coconut milk often. What do you think of the saturated fat of coconut milk? I kind of just answered that question, but it's mostly so there's a lot of medium chain triglycerides, like lauric acid in that, and that it's. I could actually make a full 15-minute video just dedicated to that question, but it's the lauric acid actually has been have shown to have health benefits. Uh, it's very much hard to isolate one thing from one uh, thing that you're eating, like coconut. So, for example, it's hard to say, okay, we're just going to have these people not eat coconuts and eat the same exact thing as these people, but they will eat coconuts. And the only thing difference between the two groups is that one is eating coconuts and the other's not. And to try to study that is very difficult to do. But basically, my recommendation is moderation again, and generally it shows to have actually health benefits. So. Okay. Does vitamin D deficiency cause hyperparathyroidism? Paroxysm? I've not heard of that. Okay, Dragon Spirit 77. This is a great point. So when I say sugar is bad for you, I'm not talking about the sugar from fruit. And actually, I explained this in one of my recent videos. The main difference, so okay, sugar is sucrose, right? Sucrose is half fructose, half glucose. And so anything in excess is bad. So if you ate 20 pounds of fruit and nothing else, I mean, that's not going to be good because that's a ton of glucose and fructose. Um, the thing about sugar, sucrose, is that are we looking at it in isolation? When you eat a fruit, that has fiber in it, okay, and then it's going to go down into your intestines, and then it's going to be split into sucrose and fructose. But also, that fiber is going to slow that process down. It's going to push that further down into the intestine, and it takes longer for it to digest, and it takes longer for it to absorb. So that's a big thing that gets overlooked when you're eating fruit. Now, the other thing is that fruits also have other good things for you, like antioxidants. Now, opposed to high fructose corn syrup, okay, that's half fructose, half glucose. It's not actually sucrose. So it's that molecule is already divided into two simple monosaccharides. So when you drink something like a soda, for example, or a juice that doesn't have any fiber in it, well, I shouldn't say juice. Let's stick to high fructose corn syrup, like a soda. So when you're drinking these soda, it's just basically a fructose molecule and a glucose molecule that's already been separated. They're monosaccharides, and they have really rapid digestion in the intestine. It goes straight to your liver, and you get this like tsunami of this huge surge of fructose and glucose going to your liver, and that is problematic. So you end up getting this big insulin response. The pancreas starts secreting a lot of insulin, and that's the problem right there. So whether it's candy or soda or something that's basically pure sugar, that's the problem. But a lot of these hidden sugars are things like barbecue sauce, salad dressings, and then it's this added sugar that becomes problematic. And there's like 260 different names for sugar on the label that are simple sugars. And so the general recommendation is once you get to 25 grams per day, that's when it starts to become problematic. So it's not like you have to go complete, like, oh, I can't have any sugar at all. It just, you have to really keep it to a minimum if you want to be at your best health. Yeah, RK says, I suffer from bad anxiety and depression. I am a Diet Coke addict. What is your take on Diet Coke or aspartame? So I did make a full video on dedicated to artificial sweeteners, and my general recommendation is to avoid it. There seems to be lots of issues with it, um, possibly cancer issues. It's not been proven yet, but there seems to be some association there. And then the main thing is when you're okay, let's say you're drinking that Diet Coke and your taste buds sense that and your brain senses that. So it gets tricked into thinking, okay, I got to start making or secreting insulin from the pancreas. So the brain tells the pancreas, okay, start making that insulin, and because it thinks that sugar is coming, even though it's fake sugar. So it's going to generate an insulin response, even though it's not actually sugar. So in that sense, I would just say it's even from that point of view, it's better not to go with Diet Coke. Water is really the best thing that you can drink. So, and there's actually some studies that compared people who drink milk versus water versus artificial sweeteners versus actual sugar. The group that drink the actual sugar did the worst. They had weight gain. The ones who did milk, basically no change. Water had the best results, and then the one with the artificial sweeteners, it wasn't, of course, as bad as sugar, but it was worse than the group who drank milk. So you obviously don't believe in the keto diet. It reversed mine, and I lost 40 pounds without medication. I wish I can do the same with C. I don't know. So anyway, Lucky Lou. No, it's not that I don't believe in the keto diet. Keto diet. What I believe in is unprocessed food, and so you can do a healthy version of keto, or you can do an unhealthy version of keto. You can definitely lose weight just by not eating carbs. That's not, I don't think that's up for debate. The question is it metabolically healthy? Well, if you do metabolically healthy version, that's going to be eating unprocessed food. But if you're eating sausage and pepperoni and doing that kind of keto with lots of processed food, I think that's it's going to eventually lead to a lot of metabolic health issues. So if you do keto, my recommendation is to just stick with the things that are unprocessed. So avocados, salmon, other fish or seafood, lean chicken breast, of course, vegetables, broccoli, and nuts and seeds as well. So it can be done. It's just very hard to eat unprocessed keto diet. William Runner says fructose corn syrup is really bad for you, and that is absolutely correct. Fruits are sugar. Yes, I did address that already. Keto is great for epileptics. Not me. LOL, says Stephanie Snow. What do you think is better for keeping food nutrition, cooking on stove or in microwave? I think it's better to go with stove, but I don't know there's any evidence that microwave is necessarily bad for you, but I would go with stove. Uh, what is a good way to slowly increase fiber in one's diet? Great question, Angel. Uh, so it's just getting in the habit of cooking real whole food. So it's hard to get unprocessed food when you're eating out or ordering, especially depending on where you live. So the general rule of thumb is you need to cook on your own and sticking to the main food groups that have lots of fiber, and you can slowly introduce them into your diet, whether that's whole intact grains, things like wild rice, not the white rice or the yellow rice. So stick with the long grain wild rice if you do the rice, beans, kidney beans, black beans, chickpeas, lentils. When it comes to bread, most of the bread that you see on the shelf is processed, it's milled. So they actually that original wheat kernel is no longer what it is. So the germ, the endosperm, and the bran. Well, the only part that's like, for example, on the store shelf, they take the endosperm. That's how they make the flour, but they get rid of the bran and the germ, where all the healthy stuff is, like the fiber. So the one that's unprocessed, that's not milled, would be things like Ezekiel bread. That's a whole intact grain there, um, and then nuts, seeds. Broccoli. So just kind of sticking to those food groups that have, the whole real food that have the fiber, and then you can just slowly introduce them with every meal that you have. Um, I love making smoothies pretty much every day. It's just a great way to get all the nutrients, omega-3 fatty acids, fiber, both soluble and insoluble, with like, for example, chia seeds, nuts, um, sometimes vegetables in there, so kale or spinach, and then you get fiber from other things as well. So it's just a great way to get all the nutrients you need, and because it's really hard for most people, if you're especially not cooking, to get all the fiber and other omega-3s that you really need in your diet. So that's a great way, or a shortcut, if you will, to kind of get you where you want to be. Bia Furpo, what is your take on statins? They have their place. That's my take. I did a video on this that was talking about that, called I think it was the biggest risk factor for heart attack, where I was talking about statins, and they have their place, but they definitely are not for everyone. And I think it's for most people, statins are shouldn't be looked at as a first line thing. It's really, statins are like, okay, that's kind of maybe like the last tool in the bag that I use, or not the last tool, but the second to last tool. And 90% of it, I'd say, in terms of improving metabolic health, improving cholesterol, especially the true bad cholesterol, those small particle LDLs, it really comes down to what you eat, and also exercise. So if you can do exercise and what you eat, unprocessed food, probably intermittent fasting helps with that as well. That's really the key. So 90% of it is really comes down to that. Now, if you can't get it back to normal after those things, then okay, statin's probably appropriate. Or if you have a genetic condition like familial hypercholesterolemia, where there's a the cholesterol runs very high in the family, and you have that, and your LDL is above 300, something like that. In that case, yeah, you will need a statin. But otherwise, it really comes down to what you eat and exercise. Sourdough. So sourdough is processed. So they take out the brand and the germ, and you're just getting the flour from the endosperm. So it's definitely processed. Okay. Let's see. Doctor Mike, doing healthy keto, but notice my cholesterol has risen, and now I want to bring that down. Yeah, Brian, it depends on which cholesterol you're talking about. So I assume you're not talking about your HDL rising, because that would be good. Um, the total LDL, for example, let's say you're eating a bunch of avocados and you're on the keto diet, and your total LDL goes up. Is that necessarily a bad thing? Really, you want to pay attention to the triglycerides, which is an indirect measure of the small, dense particle LDL. That's the bad cholesterol. So the if I were you, I'd really focus on the triglycerides. Now, if those triglycerides are going up, then that's an issue, and that's almost always due to insulin resistance, or inflammation from eating processed food. So focus on the triglycerides, and I don't know exactly what you're eating, and it's hard for me to answer in this video, but that's really what it comes down to. I'm on diclofenac for pain issues. Now on long term and having joint pain, what's your take on diclofenac? So diclofenac, it's an NSAID, so it's a non-steroidal anti-inflammatory drug, and that has all sorts of side effects. Some NSAID drugs are better than others and are more prone to the side effects, but they're all in that same family, and so that can lead to lots of problems, especially when you're taking them on a day-to-day basis. It can lead to peptic ulcer disease. It can lead to issues with your kidneys. It could lead to issues even with your liver. GI bleeding, for example, or bleeding from your stomach or intestines. So it's not something you want to take on it. I'm saying generally speaking. Obviously you have to check with your doctor, but generally speaking, you don't want to take ibuprofen or diclofenac on a routine basis if you can get away with it. The longer that you're on it, the higher the dose, the more likely you're going to have issues with that in the long term. So ideally, you don't want to be on that medication. As far in terms of joint pain, there could be lots of reasons. Usually, it's osteoarthritis from overuse, but sometimes the joint pain can be worsened when you have general inflammation in the body. And so it might be worth looking into intermittent fasting or eating unprocessed food. Of course, I always say eat unprocessed food, but generally speaking, that can help improve inflammation in the body, which might actually improve your joint pain. Also, there's things like chondroitin sulfate. And so these other things that you can take over the counter, you probably have tried them already. I'm not sure if they work for you or not, but if you haven't tried them already, certainly consider that. Let's see here. Can intermittent fasting help with blood pressure, or do I have to incorporate it with exercise? So yeah, intermittent fasting by itself can improve blood pressure. So can exercise by itself, and then when you combine the two, you're more likely to get even better results. So I would, if I were you, I'd definitely do both in that case. How come LDL go up and triglycerides go down at the same time? It really depends on the food that you're eating. So again, LDL. So there's two types of LDL. There's the large buoyant LDL, that's the type A, and then there's the type B LDL, which is the small dense particle. And but for generally speaking, 80% of LDL is the type A, the large buoyant, and this is the benign LDL, and that's though because it makes up 80% of your total LDL when you see that lab test. Um, that's the main one. But then the small dense one is about 20% of the LDL. And so usually the type A, the large buoyant one, is going to be more reflective when you see that total cholesterol LDL, or sorry, that total LDL cholesterol level on your labs. So it's possible that when you're eating healthy fats like avocados and whatnot, you could have your total LDL go up, but what you really want to look at is that type B small dense LDL. That's the one that's gonna, if you want that, if that goes up, that's gonna be trouble. And that's usually an indirect way to measure that would be through triglycerides. And so when you look at why do triglycerides go up, it's really dependent on insulin resistance, and which is really mostly dependent on what you're eating in terms of sugar. So if you want to get that triglyceride down, focus on getting those insulin levels down, which really means eating unprocessed food, cutting out or reducing that added sugar. Best grains for gluten-free folks. Thanks. Well, gluten celiac disease. That's a big topic. I should probably dedicate a video towards that. Daily probiotics, good. My take on probiotics is to eat the ones that come from the food. So kefir, for example, yogurt, Greek plain yogurt. I would focus on that. What are your thoughts on taking ibuprofen regularly every month for menstrual cramps? Yeah, I mean, ibuprofen, it's a good and a bad drug at the same time. It's a double-edged sword. So, it's a great drug in terms of actually helping people with pain and inflammation. But again, it does come with all those side effects. So, the general rule of thumb is only take it when you really need it, and try to not take it on a daily basis. Follow-up question regarding the intermittent fasting and exercise. Does it increase my HDL? Yeah, I'd say both of those things would likely increase the HDL, but the main thing is what you're eating. So usually when people do an intermittent fasting, they're eating healthier foods. It's, for example, if you're going to be binging on totally processed food with tons of sugar during your eating window, that's not going to get your HDL down. But if you're eating healthy foods during that eating window, the HDL should go higher when eating the healthier foods. They tell me my good cholesterol is high and the bad is low. That's good. Is it true that birth control helps cease further development of scarring? That's out of my window. Sorry. Is eating 1 to 2 cups of Greek yogurt non-fat good for you or not? I would say if it has added sugar, that's what you want to avoid. So the Greek plain yogurt, it doesn't taste that great. That's why they usually add sugar to yogurt. But if you're eating the non-sweetened Greek plain yogurt, that's the one that you're gonna want. That's gonna have the probiotics, the live and active cultures. And because it doesn't taste that great, usually will eat it with something else. So like making a fruit bowl or putting it in a smoothie. So when I want to go for probiotics, that's my go-to. Kefir, Big Aaron says get kefir. That's some good stuff. You can't get better probiotics than that right there. Monk fruit, okay? Asked Brian. Yeah, monk fruit sweetener. It's a natural sweetener from the monk fruit, and it's 0 grams of sugar. It stimulates your taste buds, and it hasn't been really studied that much. But in terms of side effects, I don't think it's very common for anyone to have side effects. No one that I've known has ever had any side effects from it. So I use monk fruit sweetener all the time for my smoothies, and I think you're fine going with that. If you're going to do a video on gluten-free and celiac, please include something on ulcerative colitis and Crohn's. Okay, I'll try to remember that. And let's see. Georgina says, thank you, Georgina. 1 week of water fast, time restricted feeding, opinions. So the water fasting for 1 week, I wouldn't recommend that. You're not getting any nutrients. I mean, can people survive for fasting for a prolonged amount of time? Yes. There's actually, if you remember those in Thailand where they had the boys that were stuck in the cave. I forgot how many boys there were, but I think it was like 15 or something. They were stuck in a cave for 3 or 4 weeks, somewhere around there, and they went without food for that amount of time. They did get some water. Eventually, they did get some food while they're in the still cave. Anyway, they went for a prolonged amount of time while fasting, and they did okay. But generally speaking, I mean, I don't recommend prolonged fasting. There's just a lot of risks that come with that. So the water fast, yeah, you need water to stay hydrated. But going that long without food, I think the risks start to outweigh the benefits at that point. Time restricted eating, it's the most practical form of intermittent fasting. It's the easiest for most people to do. It's basically, you don't eat for a certain amount of time that you predetermine, and you can actually fluctuate that, or you could be on a schedule depending on what you're doing. A lot of people who work night shifts, it's difficult for them to do intermittent fasting. But if you can manage to start out by 12 hours per day of not eating, and then gradually increase that, say 1 hour per week to get to like say week 4, and then you're doing maybe 16 hours per day. I think that's where you want to be, and it's not really a diet; it's actually a lifestyle at that point, and it's easy to maintain. And I think once you get to that point, it's not hard for you to just get used to that and not have any issues with the side effects such as hunger or headaches. So my recommendation is to do what's best for you. I don't think there's any one size fits all. Some studies show that time restricted eating is better in terms of effectiveness for weight loss, while other studies show that alternate day fasting is better. So it's just a matter of what's the one that works for you, and start out by doing that. And if it's too much too soon, just start out gradually. Brian says, okay, in my opinion, look at your belly fat. And this is a very great point that you make. Because if you have increased waist size or belly fat, that's really where the visceral fat is. And that's basically a sign of insulin resistance. So that's spot on. Rick Martin asks, how do I know if I have sleep apnea and need to have CPAP? Well, you definitely, if that's a question for you, you need to do a sleep study, a polysomnogram, and get that answered by officially undergoing a sleep study. What are your thoughts on the carnivore diet? Asked Tim. Great question. The main issue, okay, two main issues with the carnivore diet is lack of fiber, and the second is it processed? Are you eating processed, highly processed meat? Um, the Inuit, they, they've been studied in terms of the carnivore diet where they ate mostly caribou and whale blubber, and in the spring, summertime, they would eat some like berries, so they did get some fiber in their diet, but it was mostly fat and protein that came from the meat, the animals, and so I think their average lifespan was around 65 or so, and later on they started switching to more processed food. um, so my thoughts on that are it becomes a problematic when you're not getting enough fiber, also some of the other nutrients that you get from, like, for example, vegetables. um, when you look at, the blue zones of the world where people live the longest and healthiest lives, things like Japan, or places like Japan, Mediterranean and Greece and Italy, Loma Linda, California, Costa Rica, those are the blue zones of the world, and those are the people who live the longest lives. And all the things that they have in common, well, it's a few things actually. It's eating unprocessed food for one, or mostly unprocessed food, lots of seeds, nuts, vegetables, fruits, lean meats. And then the other thing is their lifestyle is they walk around or they do some kind of light exercise. And then social connections. That's probably the most underrated thing to living a long and healthy life is social connections, having really good, deep, solid relationships with people, good connections. And so those are the three main things that they all do that they have in common, to live the longest and healthiest life. So carnivore diet, I think the main issue is just lacking the fiber and the nutrients they get from vegetables. Oof. Stephanie Snow says I'm about to start night shift. Yeah, I used to do that. Ooh, that messes my sleep. I don't like that. I don't want to do that again. Greg says time restricted eating over intermittent fasting has been much easier to maintain over the years. So yeah, time restricted eating is a form of intermittent fasting, and it's definitely the easiest, most practical thing to do. That's why I recommend, if you're going to do fasting, go with that version. How is your dog, Legend, Suji? Yeah, Legend is great. I almost had him in the room here with me, but I figured he might be a distraction. I do 20 to 4 hours intermittent fasting, so that's the warrior diet version. Yeah, whatever works for you. 20 to 4, 16 to 8, whatever works best for you. Yeah, Josh asks, what are your thoughts about using GLP-1 agonists like tirzepatide? That's a great question. Yeah, so you lost 30 pounds in 90 days. And that's what the studies actually show, is that people are losing about 30 pounds with this drug. So I actually was thinking about making a video on this. What I'm really curious to know and to learn is what are the other metabolic effects? Is it just weight loss? Because what I would be discouraged is, okay, so people think that they can take this drug and then they lose 30 pounds, great, and then they just they eat poorly otherwise because they think they can eat poorly now that they're on this drug. So while they can lose weight, with this drug, they could actually have worse. I'm saying potentially worse metabolic issues with cholesterol numbers and insulin resistance and all that. So I'm very much curious to learn about that. So I should make a video on that. It's a great question. Loved in this live stream. Karnak, so glad you're doing a live stream. Glad you're here, guys. Thank you. Dean Orner says spending time with more of your friends and family. Yep, he's absolutely spot on with that. Being Inuit myself, I traveled to Greece. Not me. This is from Jorgen. Being Inuit myself, until I traveled to Greece, I gained weight. We eat world's healthiest food that are not processed. There you go. Unprocessed food. That's the key. Although I still hope you're getting fiber. Um, Doc wants me on atorvastatin. Is the potential dementia and other negative side effects worth it? So, I haven't seen anything that links, dementia with atorvastatin or other statins. There's a strong, strong, strong correlation with dementia, Alzheimer's, with sugar. And actually that's my next video that I'm currently working on is the link between um, sugar and Alzheimer's. Now, there's other things with Alzheimer's besides sugar. So, lack of exercise is also a big thing, and then lack of engaging with those social connections also a good thing. So, I'm not a good thing. So, you should be, exercising, and fasting can improve Alzheimer's. So, exercise, fasting, cutting out the sugar, no alcohol, social connections. That's ideally your best way to prevent Alzheimer's. But in terms of atorvastatin, haven't seen any associations with that. Definitely no proof of causation at this point. But um, I think with the statins, I'd say again they have a case for individuals in certain circumstances, but generally they should be avoided if you can, because you primarily want to prevent it with through means of exercise and what you're eating. Real food. That's what Wildwood TV says. Agree. I couldn't agree more with that. Okay, what can potentially cause red spots on the chest? Tons of things. Um, okay, Greg asks, right now there's a trend online where I see people eating raw meat like raw ground beef. Why are these people not getting sick and dying? Do you recommend a Mediterranean diet? Is this what you do? Yeah, so this gets back to the carnivore diet question. I don't recommend eating raw meat. I mean, I guess they're not getting sick. That's a good thing, but there's a potential for sure, especially with things like hamburger, which is, it is slightly processed. But yeah, I just don't recommend it. I think there's a lot of risks that come with that, bacterial infections and so forth. Now, on the positive side, that's unprocessed food. So of course, when you're eating that, you're keeping those insulin levels super low. Um, but the other question, that comes with that is again the fiber. Fiber is so crucial, and it hasn't been really studied. There was the original keto diet was based on this man who was shipwrecked, and he was forced to eat nothing but basically carnivore diet, and he was actually very healthy. I think he ended up living to his low to mid 80s, somewhere around there. But he lived a very healthy life, and so. There is, some evidence that eating these unprocessed versions of carnivore diet can be healthy, but I don't think it's going to be better than eating unprocessed food where you're getting a mix of fiber and vegetables over the long term. So again, things like the Mediterranean diet, I think that's your best bet, or something that's close to the Mediterranean diet, like a flexitarian diet. So again, look to the blue zones of the world where the people live the longest, healthiest lives. And I think you look at what they eat, the thing that they all have in common is basically a mixed or some kind of variation of the Mediterranean diet or flexitarian diet. Food has gotten really expensive, I must say. Yeah, that's unfortunately so true. Variety is a spice of life. Yep, you got to mix things up, otherwise, things get stale and boring after a while. Dr. Mike, what are the main signs of having a heart attack for non-medical people to observe? So usually it's chest pain, lightheadedness. Lots of times that pain can radiate to the left shoulder, especially left arm. Lightheadedness, but the biggest one is chest pain. The thing is, lots of times people with diabetes don't actually get the chest pain, so the signs can be a little more subtle. Shortness of breath can be another very important warning sign of that. Also, like I should mention too, like if someone looks very pale and they're having a lot of sweating, that's another clue. Okay, wondering how. Yes, Jared Law says lots of people have atypical symptoms of heart attack, especially women. That's a great point. Jaw pain. Yep. So jaw pain is definitely. So the thing with heart attack, it can lead to pain that it can even go to the right shoulder sometimes, but it's not very common. So it's mostly left shoulder, jaw pain, left arm. But usually it's a crushing type, like an elephant sitting on your chest. That's usually what happens. But again, they could have atypical symptoms. Okay. They do. Let's see. Oh, actually, I think the original. I forgot to mention this at the beginning, but the original plan was to go to for 45 minutes, and I think yeah, our time's about up here. Um, so, like I was saying before, next week I want to have a psychiatrist as a guest, and the topic is going to be ADHD. That's the plan. So, attention deficit disorder. Especially, if you look at one of the most Googled search terms, it's ADHD, and it seems like the problem is only getting worse and worse with time, especially with all these things that are distracting us, our phones, getting messages and notifications every 2 seconds, social media, especially TikTok, where they just using all these hacks to grab your attention and hook you in. And the just ADHD is getting worse and worse. So really want to focus on that. We're also going to do other topics as well, like sugar and it being an addiction. Is an addiction. It does meet all the DSM-5 criteria for an addiction. Also, just talking about other health topics down the road too that are related to psychiatry. So I'm really excited to do these live streams on a consistent basis, and I'm really glad that you came here today. This was fun for me. I hope you had a good time, and let's do this again. And I'll let you know. Just subscribe to the channel, look out for notifications, and we'll be letting you know when that live stream is going to be. So thank you all for joining me today, and have a great rest of your weekend.